So I want to bring you greetings from Canada. This is my hospital. On this side, we are a mid-size academic health science center. We're on the shores of Lake Ontario. We are the people in the formation of the 175. We are one of the oldest, probably the oldest hospital in Canada. So we are 175 years old this year, not as old as where I visited in Bruges yesterday, but certainly for us, we are an old hospital, so we have a lot of tradition and a lot of commitment to improving the health of the communities that we serve. I am so glad to be here today to talk about patients as partners, and want to say thank you to Ilsa and colleagues for opening this session, for talking from the voice of patients. This person on the slide, her name is Dale McTavish. And Dale is usually someone I would like to bring with me, but if I can't be with her physically, she's on my shoulder all the time. And Dale was one of the early pioneers of our patient experience advisors at Kingston General Hospital. And the story I'm going to tell you today has been, and my learning has been informed very much by her and by many others. And together we have moved to places that we never ever imagined that we would. My hospital, although 175 years old, in 2008 was in a lot of trouble. We were spending money that didn't exist. We didn't have money for capital infrastructure. We weren't saving enough to improve the hospital. Our operational efficiencies and indicators were poor. Our clinical indicators were poor. Our infection rates were the highest in all of our province. Our morale of our staff was low. We were fighting with government. And I hope none of this sounds familiar to you, but you may relate. And we were at a place where actually everybody thought it was government's problem to solve. And so government sent in a supervisor and an investigator and took over our hospital for a whole year. And I was selected as the leader to come in and lead our organization forward. A lot of people said, why would you ever want that job? And for me, this was a very special job because this was an organization that was hurting. Its spirit was hurt, and it needed to be better. And so I said, yes, I would come back, and because I actually trained as a nurse in the same city at the University of Queen's University. And so I thought this would be a great opportunity to come back and build on all the other experiences I had leading hospitals in other parts of the country. But it was a tough starting point. And when you are faced with many reports that say you are terrible, you are faced with many press relations that said you are terrible, actually you feel terrible. And the staff, so what I decided to do was not rely only on the reports. I went out and spent the first almost 5 months. I hired a chief operating officer to make sure that the hospital was being taken care of because we were in serious trouble. But I wanted to get out and engage and learn from people because I thought, how am I going to figure out how to bring people forward? So I met with almost 3,000 people. I met with patients, nurses, physicians, our suppliers, our government, people who lived in the community, so that I could learn and hear for myself what the big issues were, what they saw as what needed to improve. And together, we started to imagine what a good future could be like. we started to imagine what would outstanding care always look like? What would happen? What would it feel like? And the voices of the patients and families were especially poignant because they could speak so real about what makes a difference. I heard a lot of stress from my staff. They wanted to be delivering much better care than they were, and it disappointed them not to be able to achieve their full potential. So as I went around, sometimes what I heard was very difficult to hear. I will always remember in a setting where I was talking with patients and families, and we were talking about what outstanding care always could look like. And one of the women stood up in a forum very bravely, and she said to me, "Leslee, I am afraid to go to your hospital." And I thought, I can handle people not liking the hospital, not liking the food, not having a good experience, but to be afraid was something that really struck me to the core. I am a nurse by profession, and I always think of myself, as many of you would, that I am patient-centered. But somehow, here I was in a situation where somebody was afraid to come to my hospital. And I knew she wasn't the only one, because at the time, we were talking with a number of patients, and they had a lot of concerns about the hospital. And so I thought, how are we going to move ahead? We needed a strategy that could center everybody on what we were all trying to achieve. We wrote our strategy in a way that you can really see and feel the voices of patients and families and staff in the strategy. It doesn't look like a typical strategy. And we said that rather than being a hospital with walls, what people said to me is, we really want to be a community of people, a very inclusive community of people dedicated to transforming the patient and family experience. Now, transform is a big word. People talk about transforming now as if, oh yes, you're just changing direction. But transforming is about really making it very, very different. And when we thought about this new mission that we were creating, all of a sudden we thought, how as the hospital can we possibly be so bold to think that we can transform the patient and family experience on our own? I had gone out and consulted with a lot of people, but I knew that if I stopped consulting and said, thank you very much, we have all the input we need, we now have a strategy and we are going to go and implement it, that would be a very bad way to go forward. So what we decided to do, given that we had so much work to do, I asked the patients and families for help. I said, would you help us? They were a little skeptical at first. So we said, we're going to put a firm stake in the ground. Any decision in our hospital where there is a material impact on the experience of patients, a patient will be at the table. I said that 5.5 years ago. At the time, I had no idea how we were going to do this. And if you think about how many decisions are in your hospital, your organization, that you make every day that influence the experience of patients directly, how many of you have patients at the table? That's where we were. And I'm going to share with you how we made this possible. It has been a journey. It has been not a light switch that you turn on and say, okay, here we go, let's just do it. There is a lot of learning. And what we did is we started by trialing a few things and just getting going. We created a patient and family advisory council to start. We didn't even know what it was going to do. So together, we figured it out. And that was one of the most important things that we did, was we created what the Family Advisory Committee was going to do together. It wasn't our plan, it wasn't theirs. We co-designed it when we didn't even know the word co-design. So it has been a journey. One of the things it takes, and one of the things that we've learned, is it takes a lot of open conversations to build the trust and capacity to move forward. One of the very early things we did, probably about a year into our new way of working, we had an open forum in our community because our patients started to want to say about what it was like, why they chose to be advisors. But in order to help people understand why, they wanted to tell their story about what happened to them in the hospital that led them to the decision about being a patient advisor, and then what it was like to now be part of it. My public relations people, my communications people were beside themselves. My board was not happy because they said, we're just getting going. We're starting to build some positive, and now you want to go out and let everybody know how terrible things have been. And I said, if we are going to be on this journey together, we need to be able to let our patients share their stories in their voices. We need to understand what happened, and we need to know how they want to contribute to making it better so that together we can move forward. And so one of these public forums was an important turning point because there were people in the audience there who had come from the community, and there were tears because other people could relate to the very terrible stories that they were telling about the difficult situation that they had in our hospital. And they too were invited to help and say, would you help us learn? These folks, with their voices, were able to say, the hospital doesn't have it all right, but what they do have is the willingness to be open and the willingness to learn. And we're going to give the hospital a chance. And I said, I'm going to take that chance, and we will do this by honoring you and working together. The most important feature of the work that we are doing always has started at the bedside. And we are a hospital, so it's at the bedside. If you're in the community, it's at the community home. If you're in the long-term care, it's there. But you start where the patient and family interaction is happening. And what we did is we created together with our patients a new model of care. A model of care where people could count on the involvement and the engagement of patients, where they could count on people doing hourly rounds, where they could count on people introducing themselves, where they could count on the interprofessional team involving them in the discussions and the plans about their care. We put the patient records at the outside of every room. We invite people to participate in the viewing of their records and in the conversations about their plans of care. If you don't start with meaningful engagement where it matters most to the patient, which is the closest to their experience, you are going to miss the mark. Don't parachute up and say, okay, we're going to put a whole bunch of people on boards. If you do that without the meaningful engagement where it matters most, you are going to miss all the opportunities to improve. It is important to link the boardroom. And what we did was a couple of things. One, as our Patient and Family Advisory Council got going, one of the first things that they observed, they said, "What is it about these visiting hours?" How many people have restricted visiting hours in your hospitals? Aha! So here is a story for you. So the patient said, "How come?" We actually didn't have a very good answer. Our nursing advisory committee said, "Well, we need the place cleared out so that we can do our work. We need it to be quiet because the patients need rest." The doctor said, "Well, we can't have all these people around because we have to do our work." And the patient said, and the visitors only in small doses. And the patient said, "That's not a visitor. That's my husband. That's my sister. That's my child. Even that's my dog." We let dogs in our place. And it's amazing because they are not everywhere. We don't have dogs running wild. But we do if it matters to the patient. The family is who the patient defines the family as. We had our own definitions. We said only next of kin, only this, only that. When you start to look and hear from the patient's eyes, you realize much of what you have doesn't make any sense at all. And so what we did was we said, okay, we are going to take that advice, and boom, we put in opened up the patient and family visiting hours, and we now call it, we have a family presence policy. And family presence is built on the value that families bring to the experience of healing and well-being in the hospital. And it did take us a little while to convince areas like critical care. Now they are the champions for this because they see every day how important it is, not only with the presence, but to the inclusion now of families on all the rounds. We don't call them doctor's rounds anymore. They are patient rounds. And you can't have patient rounds without the patient and the family. Period. So what we need to do is start solving the issues together and then making sure that we have the right policies and practices and hold people accountable for continuing in that way. Policy changes are also part of this. And Minister, you will appreciate this. So the lady who is circled over here is my favorite Minister of Health, Deb Matthews. And Minister Matthews came to cut a ribbon at our hospital, and I said, "You can't leave until you meet with our Patient and Family Advisory Council." They were just getting going. So we were going into the room, and she said, are you coming? I said, "No, you talk to them." And she said, "You're letting me talk to them like without you?" And I said, "Absolutely." And so the Patient and Family Advisory Council had a meeting and with the minister one-on-one. And what she heard were some very important things that informed her work as a minister to support this on a policy level. She asked them questions like, should I legislate that everywhere have a Patient and Family Advisory Council? Our patient advisors said no. Don't say the how, say the what. What you want to achieve is partnering with patients at every step. What you want to achieve are the voice of the patients having an equal and appropriate voice in the shaping of policies that affect them at the government level. And then then at another conference, and she sees one of our patient advisors, invites her on stage, and they talk together about what it's like to have the patient voice included. Because what she realized was what we said we wanted a patient-centered system in Ontario, in my province, but we didn't put any structures or policies or legislation in place to say, this is the way it's going to be. We now have something I was sharing with the minister the other day of something called the Excellent Care for All Act in Ontario. And now patients, we need to demonstrate as the hospital, we all have quality improvement plans, and I must show how patients and families have been involved in the development of that quality improvement plan. I also have to show that the doctors have been involved and that the staff, and that they are also part of helping to monitor the success and the outcomes associated with the quality. This has started to change the conversation about quality in our organizations. This is a framework you can refer to later. There's the journal Health Affairs in February of 2012, a whole journal dedicated to patient engagement. I like this framework because what it does is it talks about the levels of engagement across the top, going from consultation, involvement, and full partnership and shared decision-making. Along the vertical axis, direct care, organizations, and policy making. What it reminds us is that it's not the same at each part. You need to really look at where you are and think about what you can do together, but full partnership in everything is not always the goal. But it is part of a journey that together you need to decide with the patients and families what the goals are. So what's in a change? We have been involved in a lot of big change in many, many parts of our organization. And one of the things I wanted to share with you is a few things, that it's not all easy. And yet, just because it's not easy is no excuse for not acting. Because you actually have to go through this and learn yourselves to feel it, to make it strong together. This is a picture from one of the changes we implemented. Our food was terrible. So we actually implemented some changes for our food services that we needed to reduce our costs, improve our quality, and we were getting to the point where we were having to invest in some big new technology, and we said, stop, let's see what are the other ways we could do this. And so we decided to involve our patient and some families in the whole process of the development of the request for proposal criteria. What were we out there looking for? In the RFP process, the team that decided on what the vendor was going to be, they were involved in tasting the food to see whether or not one company was better than another. And we ended up making a selection that we could, for our hospital, was very positive. I had protests from the unions outside my office for 5 days. We had, for a whole month, protests on the radio, on the TV. Even though nobody was losing their job, it was a change. And one of the things I learned from this is that sometimes everybody can say they're for the patient, and it's not always meaning the same thing. You have to be very careful when you go down the road of patient and family-centered care, that you're not just speaking the words that are not upheld with behaviors and actions that are true to what you say. People will see through it. And in fact, you've got to be careful about other people who say, yes, 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 we're all for the patient, but you've got to bring them along to make sure that their actions and their words are the same. This is about truth and trust. The transparency that I know you are committed to with your indicators, this transparency is vital for building the relationships with patients and families and making change. Also, for providers and CEOs and boards and physicians, you need to see the information, understand it together, and then figure out, keep everything out front. We made a commitment early on that everything, the good, the bad, the ugly, everything would be transparent. And people said, you're giving people too much information. I said, if anybody says stop giving me information, we'll consider it. But nobody said stop. People said, help me understand it. What do I do with it? Can we talk about it? That you want to do is stimulate the conversations, and with truth and transparency, the path starts to change. But I want to tell you that it's not all easy, and even when in our place we had made some very good progress, people were talking about the good things that we were doing. But about a year and a half in, something happened. And we had a patient, we called the person Brian, and he died of a hospital-acquired infection in our hospital. And it was the first patient that I knew of on my watch that died of a hospital-acquired infection, which is essentially dying because of us. And I was very upset because I saw that we had made a pledge and a commitment to our patients and families and our staff, and we said, we are doing everything to keep you safe. We believe that we are patient and family centered. We told you that we would be. We said that we were going to do this. And yet, Brian died because we weren't washing our hands. This is a preventable death. So I called everybody into a room like this, and it's the first time in my whole career I lost it. Because I said, this is not okay. How can we, when we know the evidence is so clear and so compelling, you wash your hands before you go in to see a patient, and you wash your hands when you leave the patient's room? There's all kinds of evidence, and in fact, only 40% of the time we were doing it. So I said that means 6 out of every 10 people are intentionally harming patients. That's not okay. So we rallied and said, here's the policy, here's the expectation, and if we can't get this hand washing right, we have no right to be wanting to do anything else with innovation. So I actually also said, the first time ever in my career, I looked at everybody and I said, if you don't like this, and you don't think this is the right policy for our hospital, and you aren't willing to stand by this policy and practice it, I will gladly accept your resignation. I don't care if you're the chief of surgery. I don't care if you are the most likable nurse. It's not okay. Because we killed Brian. And that's a very hard thing to face, and we needed to be better. And I knew we could be better because everyone said they wanted to be better. We asked our patients and families then, what can you do to help us? And they said, post the hand washing results of every unit on the units as you walk in. Nobody wants to walk in and say, oh, great, we've got 50% of people on this floor wash their hands. How comfortable would you feel if you were a family member walking to see your loved one and only 50% of people were washing their hands? None of us would accept that. Nobody. Why should our patients accept it? And so we did that, and our hand washing rates have been between 90 and 95% consistently for 3.5 years. And it is a vital behavior because it was part of our signal of commitment that this is real, and it helped us go forward. When you bring patients and families in, a lot of times people will say, oh my goodness, we can't do that. They're going to have too many wild ideas. They're going to want to do everything. They're going to want to spend money. They're going to want to change the color of the hospital. They're going to want to fire the CEO. I said, that's okay. Let's actually get in there. But new ideas, new eyes bring new ideas. And that's uncomfortable. When in fact, and I realized though, that when I was in the United States receiving an award on behalf of the hospital, I was introduced and the person said, I've got to go to Kingston. Up there, they let the patients run wild. And I thought it spoke to something that was a fear. And in fact, I have to tell you that never in our 5.5 years have we had a situation where we've been working on things that really were wild and crazy from the point of view of what others might have thought. They're not when you bring together and you focus on an unmet need together, you get to brand new places, brand new ways of doing things that are truly fantastic. But it's not off the wall, and most of the things that we do, they don't cost money. It doesn't cost money to say we are going to have a standard in our hospital where people greet people with a smile and respect. Holding people accountable is key. So we now have accountability standards right through the hospital that say, right from CEO through the hospital, of accountability for upholding the standards of patient and family-centered care, for involving and engaging patients in everything that they do, and for making sure that the standards we say are being implemented are implemented. So that is in my performance review. It's in the directors, the medical directors, and the frontline staff. This has become part of the accountability systems because I believe that without holding people accountable, you can't just wish this to happen. It's not a punishment per se. It's not a heavy hand, but it is a reminder that we have committed together to move forward. We have results that are impressive for the hospital performance overall. Our budget is balanced, our operating results are better, our infection rates are low and have been lowest in the province for the past 3 years. Our hand washing rates are high, our morale is higher, people are engaged, and we are solving problems differently. So I want to share a few examples of how these problems are being solved differently, and this is through something we have created called patient-centered leadership. Because as the emphasis was very much on the front line, leaders, and like me, said, so what am I supposed to do? What am I supposed to do as the leader of the organization? This is not something I just turn and say, oh, you people out there on the front line, you do this. I will continue to do the same thing I've always done. This is about all of us. So I designed a model called patient-centered leadership, and it's very simple. And these are things you can start doing in your practice of leadership no matter what role you have. You can start doing this tomorrow. The first is to see the patient and people behind the numbers. We have a practice at KGH now we call peopleizing the numbers. Peopleizing is not an English word. It is not a word in any dictionary, but it is our word. And what it means is that we start to look and see and talk about our statistics in a new way. How did we come to this? At the Infection Control Committee, which is one of our medical advisory committees, one of the very prominent medical advisory committees, a patient we have patients on every committee, every council, everywhere in the hospital. And the patient at the Infection Control Committee, when they were putting up the statistics of about 0.08% improvement over the month, she said, so how many people came to our hospital without an infection this month and left with one because we gave it to them? That is hospital-acquired infection. That now, when we talk about emergency wait times, we talk about the number of people waiting for X hours. And my rule is, if we can't convert the number into something that is meaningful for patients, and you can peopleize, I really don't care about the number. We do have things we need to report, and I'm encouraging you in your work with indicators, peopleize the numbers. Have indicators that mean something and that matter to patients and that you can put a face on it. And if you can't put a face on it, why are you looking at it? The next from a leader is to share stories. Stories are powerful shapers of culture. So ask yourself, have I shared a story today? Look around, observe, catch somebody making a difference in the patient and family experience, and then tell somebody about that. Tell them what it was like. Tell them what difference it made. Share a story and pass it forward. Ask yourself at every turn, have I included a patient? Look at the decisions. Look at your calendar for the week. All the way you're spending your time. All the decisions you're about to make. Have I included a patient? And how am I going to include a patient voice, a perspective in that decision? We now have patients on all of our interview panels. They're selecting our staff because we pride ourselves in being patient and family centered. And now what staff say when I go to orientations, I say, how many people were hired with a patient on the interview panel? And the ones that put their hands up, I say, what was it like? And they say, that's why we came to work at Kingston General Hospital. Because you're not a hospital that just says you're patient-centered. You actually are. And that made a big difference to me. That's the place that I want to work. The other question I ask myself, and I ask all my leaders, and when I do rounds on a regular basis in our hospital, I ask the question, what have you learned from a patient today? Not what did you do to a patient today? Not what did you do for them? Not what did you do to them? But what did you learn from a patient today? And as a leader, I don't care what role you are playing, if you can't answer the question, then you're not spending your time as a leader in the right place. Because in order to be patient-centered, you need to engage and you need to learn. And I'll tell you, as a leader, it has been the most invigorating past few years in my entire career. I am motivated, inspired, and every single day, because I'm learning from patients and families, and you can too. Because if you've got to put yourself at the center of this patient-centered leadership, not because you are the center, but because you need to own and be accountable for this. If you take nothing away, this is something that you need to help make happen. This is not a project. This is actually a way of being. There are a number of winning conditions, things that in our organization we see, and when we have visitors from other places, the things that we tell them that are important for success. A strategy that is clearly articulated around what you want to achieve from a patient-centered perspective. You must have leadership support. I kept saying, yes, I support it as a leader. I'll tell you, if you have a hospital where the leader is not visible and visceral support, everybody knows it, except maybe you. And everybody knows it, they can tell, and you must step in this circle. The culture of continuous improvement, and you have that, we have the same language, because you're not going to get it all right. And that's okay. You experiment, you do it together, and you learn, and you keep going. Champions and changes. We worked in partnership with a hospital in the United States, Georgia Regent, that we've met at a conference, and we said, would you help us? And they said, sure. And they came to our hospital and shared their stories, and we exchanged with them. We do video conferences, and because we've been learning together. Connecting the dots. This was one of the awards that we won, because that's where we know we were learning from each other. Infrastructure doesn't need to be a lot, but you do need to support this. We have one individual who spends half a time of his job as the head of our patient and family advisory program, and we put a physical office in the hospital so that families and patients feel welcome when they are coming to work as advisors. Hold the gains and keep on learning. I wanted to just have a final couple of slides around not only are we learning, but we are continuing to get rich from learning from others. We now have had 153 organizations come to our place to learn. And it's about immersing themselves in the experience so that you can feel it. And the other thing is, as you are sharing your learnings, you are bringing people here. I'm going home and learning myself about things that you're doing that I also am very keen about. And we are actually writing a book on the KGH story right now with our patient and family advisors to help so that we can share the experience with others. And we're proud of what we have done, although I have to say I never could have predicted how powerful this shift is. It is, and we ended up, I was so excited when we ended up on the front page of our national paper, above the fold, with patient advisors as a prescription for healthcare power shift. This was really something because it's also not just our hospital. There's many that are now getting on board and starting to work and learn and be in different ways. And this notion of the shift of the patient really at the center is happening across many organizations. In fact, it's happening around the world. And you are part of, right now, there is a global shift where people are talking about this. They're wanting to learn more. This sign of patients included is from one of my new Twitter friends, Lucien Englen, and he is in the Netherlands, not too far from you. And Lucien has this symbol that we're adopting in Canada now with an organization that I'm in that's called Patients Included. So what we're doing now is on conferences. When we have conferences, they are going to be Patients Included conferences, so that patients, we know that they are there. When we have policies, they're going to get designated as Patients Included policies. And in fact, what we're talking about in Ontario is Patients Included legislation, to actually help always that notion of including patients and families as partners. I just went to a conference in British Columbia a couple of months ago, and 33% of the attendees were patients. It changed the conversations. It was the best conference I've ever been to. We weren't all talking about ourselves and all those other people out there that had to change. We were talking about change together. Patients have stronger, more influential, real-time voices. If you don't ask and include and listen, your patients are going to talk about you anyways. Social media is big. Real-time voices are real. There's many interesting ways to organize. I'm very impressed with Ilse and the work that you're doing on the patient platform. And there's lots of different ways in which patients can organize and the voices can be together. But also the message for you as leaders is you must open up because it's happening all around us. Many organizations, many countries are now setting out plans where they're saying, we are going to create a patient and family-centered system. And these are the features of the system. And we are going to put all the steps in place. Measurement of what those features are is a vital step along the way. This is a fellow. Do you know who this is? Copernicus. Copernicus. I think we're having a Copernicus moment, and I'll tell you why. This was the fellow who everybody thought was crazy, because he said, the Earth is not the center of the solar system. It is the sun. I believe that we are having a Copernicus moment in healthcare. I believe we're finally starting to see that the providers, the hospitals, the politicians, we are not the center, nor should we be the center of the healthcare system. It is the patient. It is the person living with their chronic illness. It is the individual. And then once you recognize that, and you think about the patient as the sun of the solar system, our ecosystem of healthcare, nothing looks the same from there. Your perspective changes, what you do changes, and I believe very much that this is starting to shift, but this is where it starts. All the science, all the books, all the talks, they will just go above and be easy to ignore unless you start to think and put it in your heart and really recognize and commit to being a change. And even though some people may think you're a little out there, I welcome you into this circle because it is exhilarating when you see the meaning that it can create and the change. Our hospital imagined what it would be like if we lived the philosophy, nothing about me without me. That is what the words were when a group of people got together in Salzburg 15 years ago and created a world called People Power. And they said, what would it look like? What would it feel like? And it's nothing about me without me as the center of the system of everything that happens. At my hospital, we said, we're going to make that real. We are going to build a hospital and an experience for patients and families that is built on the philosophy of nothing about me without me. I am happy today to share what we've learned, what we've done, and some of our hopes for going forward. And my biggest hope for going forward is that you share in some of this new insight and that you share in the determination to change so that together we really are creating a global movement where people of all professions and all our patients and families know that what they too can experience is nothing about me without me. That is my dream, and I am so glad today to be part of your learning and your time together. Thank you very much.